Good morning and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada and my co-host today is Melvin Falks, Program Coordinator over our Case Investigation and Contact Tracing Program at Roots. And we're reporting for the week of August 31st, 2020. As health professionals rooted in Oakland, serving some of the people at greatest risk for contracting and suffering from COVID-19, we are here to cut through the noise and give you information you can use to keep yourself, your family, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week. If you have questions, please submit them in the comments, direct message us, or email us at admin@rootsclinic.org. Cases and deaths continue to climb in Alameda County. We now have over 18,000 cases in the county, and over 7,000 of those are in the city of Oakland. One of the things we are concerned with and are still watching closely this week is hospitalization and ICU rates. As of Thursday, August 27th, according to the county's dashboard, we have 25.2% of our ICU bed capacity remaining. 25.2% of ICU capacity remaining is an all-time low for us in this pandemic. As we head into flu season and people become ill for other reasons, more ICU beds will be needed for them as well as for COVID-19 patients. Therefore, this is an indicator we will need to keep a close eye on as we are watching COVID rates and COVID hospitalizations. Now, we know that even though this pandemic is worldwide, the impacts are different depending on where you are. So we're here to give you up-to-date information about Oakland and East Oakland in particular. Many of you have undoubtedly heard about the high number of cases in the Fruitvale area of Oakland, which is in the 94601 zip code. And we are all very concerned about that. Today, I'm here to let you know that we are now seeing our neighborhoods further east in the city of Oakland with even higher rates. According to the county dashboard, the positivity rate overall for the county is 5.2%. That is 5.2% of people tested are testing positive. Now, in the 94601 zip code, 15.6% are positive, almost triple the rest of the county. And now we are seeing that 94603, 94621 have surpassed the positivity rate in the Fruitvale district at 16.2% and 17.1% respectively. And if we look at Roots data, what we see is similar, if not a bit worse. Where of those we've tested in the city of Oakland, our positivity rate is 14%. In the 94601, it's 21%, and the 94603 is catching up at 20%, and 94621 has gone up to 23%. So the bottom line is the virus is hitting Oakland harder than most parts of Alameda County, and it's hitting East Oakland even harder. That is our reality. So now we have to decide what we are going to do to address this reality. For now, without a vaccine or a cure, our best is to mask, distance, test, isolate, and contact trace. Now, if you mask and distance, you may not need to test or isolate because in all likelihood, you will not be exposed. It's when you or someone you live with gets too close for too long without a mask that you will need to test and isolate yourself, and especially isolate yourself from those at risk of doing poorly if they catch COVID-19. And if you turn up positive, that's when contact tracing becomes critical. To keep yourself and your loved ones safe, do not socialize in person, party, or hang out with people outside of your household. But as sure as you've heard these recommendations, I know that some of you out there will insist. So in that case, please limit who you're with, do it outdoors, wear masks, keep at least 6 feet away from one another, and do what we're calling BYOE, bring your own everything. Don't share. I see too many of you out here sharing. Whatever it is that you do, bring your own. Sharing is not caring. Whether it's a bottle, a blunt, a glass, bring your own. Keep a guest list or a sign-in sheet with phone numbers so you know where to reach everyone in case someone gets COVID-19. I'm serious about this. Make sure you know how to get a hold of people you've been around. I'm sure we would all rather get a phone call ahead of time saying that you may have been exposed rather than finding out after you start to feel sick or after you've exposed someone else that may do poorly if they catch COVID-19. This is a form of contact tracing and is one way that you can do your part to stop the spread. And now my co-host, Melvin Falks, will go into more detail about the contact tracing process. Melvin?
Thank you, Dr. Noha. Good morning, everyone. My name is Melvin Falks, and I'm the Program Coordinator for the Case Investigation and Contact Tracing Unit here at Roots, where I personally oversee a team of 14 contact tracers that provide personal follow-up with patients that test positive for COVID-19. The Alameda County Department of Public Health has entrusted Roots as well as other community health centers to help with the big job of contacting every COVID positive person in the county as well as their contacts. Through contact tracing, we provide those who have tested positive for the virus with all the appropriate information and resources needed to properly isolate for a duration of time. Additionally, we are able to investigate where and who the patient has been around prior to knowing their diagnosis in efforts to end the spread of the virus. After assessing the needs of the patient, a member of the contact tracing team will contact a list of people provided on the behalf of the patient to inform them that they may have been exposed to the virus, therefore encouraging them to get tested while extending that same support and available resources to them as well. To be more specific, if you happen to receive a positive test result, first you will receive a phone call from a clinician that will tell you you have tested positive. Later, a member from our contact tracing team will get in touch with you to provide you with step-by-step directions of how to properly isolate so that you're not potentially infecting others. In addition, we will connect you with the appropriate resources to support you through your isolation period. Not to mention, the same level of information and support is extended to the list of contacts that you provide at your discretion. If you disclose to a contact tracer that you are experiencing symptoms out of the ordinary, you will be immediately connected to a Roots clinician who will assess your condition to help determine if it is best to see a doctor at a nearby hospital. With that said, if you happen to receive a phone call or a voicemail from someone mentioning that they are calling on the behalf of the Alameda County Department of Public Health, which includes my team here at Roots Community Health Center, the most important thing is to take that call or call that number back so that you are receiving all the support that you need during this challenging time. Even if you have not been tested, someone you have been around may have tested positive, and the phone call might be to tell you that you have been exposed. This is a phone call you want to take. Whether you're experiencing medical concerns with your isolation period, experiencing financial hardships, or in need of emotional support, just know that our contact tracing team is here to support you in your time of need. Now for this week's Mythbuster. Each week we will address some of the widespread myths about COVID and bust those myths with the best facts that we know at this time. If there's any information out there that you want us to report on or you want us to know if it's fact or fiction, submit your questions to Facebook, direct message us, or send an email to us at admin@rootsclinic.org. This week's myth. Contact tracing is a new way for the government to spy on or track you. Contact tracing is actually a very old, tried and true method that dates back to over 500 years. Contact tracing is one of the most important tools in stopping the spread of communicable disease and is still used for infections like syphilis or HIV. As Dr. Noha mentioned earlier, there are over 18,000 cases in Alameda County. This is a huge volume like nothing any of us has ever seen before. Even if they wanted to, contact tracers simply do not have the bandwidth to do more than what I've described. Give you the information and resources you need to safely isolate and help stop the spread. Our only interest is getting ahead of the virus, and contact tracing is one of the most important public health tools we have to just do that. But it only works if you answer the phone and if you share information about where you've been and who you've been around so we can do our job. So I apologize in advance for asking somewhat personal questions. It's only so we can do our job and keep our community safe. Bottom line for this week's Mythbuster, contact tracing is not for the purpose of spying on or tracking you. Contact tracing is an absolute must if we're going to control the spread of this highly contagious virus. So please, pick up your phone, especially if you have been tested for coronavirus. Please answer your phone, both to get your results and to speak to your contact tracer. Now back to Dr. Noha for some final words.
Thanks for that, Melvin. Here's our best advice one more time. Do not socialize in person, party, or hang out with individuals outside of your household. Don't do it. I repeat, don't do it. But if you insist, limit who you're with, do it outdoors, wear a mask, keep at least 6 feet in between you. BYOE, bring your own everything. Don't share. Keep a guest list or a sign-in sheet with phone numbers so you know where to reach everyone in case one of you gets COVID-19. And please, please isolate yourself away from those over the age of 50 or those with underlying conditions that put them at risk for doing poorly if they contract COVID-19. Some of the saddest situations we have come across so far in this pandemic is someone who gave COVID-19 to a parent or a grandparent who ended up being one of the 257 people who have died in Alameda County from COVID-19. This is not an outcome that any of us wants to live with, so please act accordingly. This concludes today's health briefing. Please submit your questions in the comments, direct message us, or email us at admin@rootsclinic.org. Thank you for joining us, and we'll see you next week on Tuesday at 10 a.m.